Hi, I'm Perry Atkinson, General Manager here at theDove. Hey, check out our other videos and check out our website at thedove.us.
Welcome back to Focus Today. Steve Johnson with you, along with Dr. John Forsyth. He's a retired cardiologist and COHO Chairman Emeritus. COHO is not the salmon. It is choosing options and honoring options, and it has to do with decisions that you make to make sure that things are put into place as you kind of move into your life, into the sunset years and so on. And you know, we've talked before about some of the seminars that are coming up, and I know you've got one coming up in April, but let me discuss the most recent one. It's called Forks in the Road, Choosing Levels of Treatment. You've been a part of making these happen. On March 12th, what is the discussion going to be about?
It's going to be about one of the sections of the POLST form, this wonderful form that Oregon has now had in place for 10 years, by which people can help to decide for themselves ahead of time the kind of care they would prefer at the end of their life. So the three parts of that: one is whether one would want to be resuscitated or not, one is whether or not one would want artificial nutrition and hydration at the end of life, and the third one, and the one we'll be talking about this week, has to do with the intensity of care. And in that regard, in the POLST form, there are three choices. One is comfort care, which is what most people choose for care at the end of life. One is really vigorous care, intensive care. Only a tiny percentage of people actually choose that when they have the option. And then the other is kind of something in between, going to the hospital, having comfort care, and maybe a little something more if specific reversible issues are present.
So the first one you mentioned, which is a comfort care, is that kind of like a hospice type of a care? Is that fit in that category?
That is the kind of care that is offered in hospice, but hospice is pretty much limited to the last 6 months of life. And so comfort care is something that people choose oftentimes sooner than that in their life. It can be integrated into regular care, into aggressive care, actually. So.
Okay. You know, before we get too far, I want to mention about the POLST form,
yes,
which stands for, let me get it right, Physician Orders for Life-Sustaining Treatment. Now, we've heard of these kinds of, I guess they are forms before, and here's a sample one. It's very pink. They are this color, right? Okay.
And it's one page.
Okay, that's nice.
Yes.
Yeah, all right. So, in other words, somebody fills this out and it is an indication about life resuscitation, how the end-of-life treatment should be given if they cannot do it on their own. Is that the idea behind that?
That's exactly right. One of the things that we know from a large research study that was done about 5 years ago at the University of Michigan is that 70% of us in the last month of life are unable to participate in making decisions ourselves. And so other folks, well-meaning folks, our family, our physicians and so forth, end up making those decisions for us if we don't have something down about what our preferences are. Universally, or almost universally, when it's left to that vacuum, those decisions are made to do everything possible, the most intensive care. Whereas if we ask people ahead of time and they indicate ahead of time, only 6% of people choose to have aggressive or intensive care at the end of their lives.
So they may choose the more passive or something in between the two, is that right?
That's right.
Okay.
There are three choices with respect to intensive care on this simple POLST form, which one can decide ahead of time. Now, you don't want to do it way ahead of time because you don't want to rule out something that might really be of value to you. So this is for people who have serious illness, who are approaching and know they are approaching the end of life, and so they can establish their preferences. It must be signed by a physician. So a physician must say, you know, you are near the end of life and these are indeed your preferences. So it carries a lot of weight in the medical world.
Okay. I'm glad you mentioned that this isn't something that somebody who is not in that situation would fill out. Everyone understands there's a diagnosis, there's a problem, the doctor has signed off on it. So the doctor doctor keeps this in his office, does he, this form itself?
No, actually this goes with the patient, everywhere the patient goes.
It's pretty big. How do you do that?
Well, there is a small part that one can put in one's wallet, interestingly.
Okay, and I've wondered about that, because here,
yes.
if you have a problem and you're incommunicative or whatever,
right.
I would imagine that the emergency people come. Is this something that is a wristband or around your neck, or what is it that
There's
indicates
a little wallet card.
Okay.
You can get a wristband that says you have one of these, but the nice part in Oregon is that a copy of this form is available within 2 minutes from a central repository that's up at the medical school in Portland. And so if you have a heart attack and an ambulance picks you up and you have this little card,
right.
they know to call this 800 number, and within 2 minutes they can know what your preferences are.
Okay, that's what I was wondering, because I imagine that would put some of the resuscitators in a difficult situation if they didn't know what to do with that.
Absolutely, and they are under the gun legally to proceed with full-bore intensive care unless a person has indicated otherwise. Fortunately, here in Jackson County, through the direction of Dr. Paul Rostikas, who is the head of our EMT system here, it's a large system, our EMTs are really schooled and very knowledgeable and very respectful of people who have these kind of choices on a POLST form.
Yeah. Do you have any idea how many people have filled out a POLST form right now?
The POLST form, since we've had this repository, there are over 300,000 Oregonians who have completed a POLST form and have it on file. In Jackson County last year, there were about 1,500 new POLST forms filled out and placed into the repository.
I would imagine that they find out about this through their doctor. Is that right?
That's where you get this form.
Okay.
This has to be done with your doctor. And so this is you and your doctor having this discussion ahead of time, and he's saying, or he or she's saying to all caregivers, this is what this person really wants, and I'm signing on the line here to say this is what we like done. Okay,
now that's kind of an overarching desire to have people fill this out, I think, as they're looking at this whole Facing Mortality series that you have going on. Talk a little bit more about the choosing the levels of treatment that's coming up on March 12th. Now, this is going to be, let me get the place correct, is this at the Smollen Center once again? Yes, it is. This is at the Smollen Center. Okay, March 12th, and you always have two of them, one in the afternoon and one in the evening, so 2 o'clock or 7 o'clock. We'll tell you more of the specifics on that. So does this POLST form then come in directly to the choosing levels of treatment? Is this the treatment we're talking about in this form? That's exactly right. Okay. These 3 levels of care, of intensity of care at the end of life, are really the broad choices that we have. And so this makes them explicit in this. And so each of our speakers, Dr. Bruce Van Zee is going to talk about, he's a retired nephrologist here in the Valley, is going to talk about comfort care and what that option means in care at the end of life. Dr. John Jackson, one of the most beloved internists in the Valley, who just retired himself, is going to talk about the intermediate part of things, about what might be entailed if you choose to have intermediate care at that point in life. And what does that mean? Right. And Dr. Brian Gross, who is one of the most honored and able cardiologists in this part of the country, is going to talk about the intensive care and what that might look like at the end of life. So 3 very highly respected physicians with a lot of experience in each of these are going to talk about kind of what these 3 forks in the road might look like. I see. So, all right, now you're the 9th inning batter here, coming up to hit the home run on April 16th. On April 16th, and there's a reason for that. April 15th, as you know, is... Oh, tax day? Yes, and so there are a couple of things in life that we don't have much choice about. One of those is taxes, and one of those is what happens in the end of our life. I can see you already know what you're going to be talking about on the 16th. Let me mention, it's Creating Your Advance Directive. It's a workshop. So is this, people are finding out about the information here, is this where they actually come and fill out forms? That's right, and what we're talking about is the Oregon
advance directive.
Yeah, let me hold this up here. Now, this is a form. Is this something that they can get from their doctor?
Or you can get those at the COHO meetings, or at the workshop.
And give an idea. I mean, this is fairly small, but it looks like there's a lot of information in it.
This is much more extensive than the POLST form.
Okay.
It's much more general, and it's about preferences, not about a doctor's orders. So this can be done early on, any time in life.
And fill that out first before you get to the nitty-gritty of this.
Long before you get to the nitty-gritty of this.
So in other words, does this help people work through questions they may not have even thought of?
That's exactly the point, Steve. It allows us, because in our society, and many of us as individuals, have real difficulty in talking about this subject. And so this helps us begin to have this very important conversation with ourselves, with our families, with our caregivers, about what kind of care we might really want if we have a terminal illness which is not reversible.
Now, even though some people may have missed out on you had a seminar on the 19th and the 26th, they can still come in on the 12th.
Absolutely.
And catch up, kind of, right?
Each of these is a separate entity unto itself. And so this one then moves from choosing options, which we've been kind of working on, to really kind of in the final stages of life, what kind of care we really want in addressing these 3 levels of care that are addressed in the POLST form. So.
All right, as you look, because you helped to plan all of this out, right? You had a hand in this. What is it that you hope, once people have gone through either all of these or some of the key ones, that people will have decided in their mind? What is it that you hope will have been achieved that way?
What I would hope for is that people would feel more open about talking about this issue.
Because right now it's kind of closed. Is it between family members? They just don't want to discuss it?
It's often not even amongst family members. We oftentimes don't talk about it until the moment of crisis arises. And we miss out on this wonderful opportunity to have such a meaningful conversation, to talk about what matters most to us in the world with the people who matter most to us. And so that's what I would see as the real opportunity here, is for people to have this very meaningful conversation, and then to write down a few things about what they would actually like. But the forums are really secondary to having that discussion.
It looks as if the forums are almost just a conduit to be able to use to have that conversation.
It's really a conduit to the conversation, and it is a means of communication to caregivers. When we get to that point in life where many of us are unable to speak for ourselves in that regard.
From your experience, I mean, we're talking about somebody like yourself who's been doing this a lot. Do you find that a lot of people do lose that ability to communicate?
Yes.
I mean, is it a high percentage from what you've seen?
It's about 70%.
Oh, wow, that's higher than I thought.
In the last month of life, about 70% of us are either mentally or physically incapable of sharing in decision making. Now, we may be able to transmit our emotions and so forth, but we're unable cognitively to help with the decisions. And these are not easy or simple decisions. These are oftentimes pretty complex decisions.
And the nuances of it all, I imagine you cover here, but that would be difficult to have when it comes push to shove and somebody can't really communicate. You're trying to guess what their thoughts are, and maybe in a broad sweeping stroke, hopefully you can find out, but not the
and oftentimes in a very small passage of time. You know, if you're having a heart attack or you're having a cardiac arrest, we don't have much time to talk about that at this point.
And this is a community also where we're still seeing this population age, aren't we? I mean, there are a lot of retirees still coming here.
That's what's really pushing this, I think. This great demographic wave of baby boomers who are now entering the time of their life where they're beginning to develop these serious illnesses, caring for their parents who have these serious illnesses, and beginning to have to confront these very difficult decisions.
Hey, this stuff wasn't supposed to happen to baby boomers. It was supposed to happen to everybody else.
That's been the thought of every generation, I'm sure.
Dr. John Forsyth, retired cardiologist and also COHO Chair Emeritus. He'll be speaking on the 16th. In the meantime, it'll be March 12th for Choosing Levels of Treatment, exactly what he was talking about with the Advanced Directive book. For more information, you can go to the website, I would imagine. Oh, cohoroguevalley.org, cohoroguevalley.org. In the meantime, it'll be March 12th, 2 in the afternoon or 7 in the evening. Thanks for being with us. Appreciate it.
Thank you so much for having me.
All right, and coming back, we're going to be talking to Lori Cardoza-Moore about, she was sitting there and she was able to, I don't know if she shook hands with Benjamin Netanyahu or not. We're going to find out coming up in a couple minutes here on The Dove.